In the second class of cardiovascular system, we will see ischemic heart disease. Ischemic heart disease, the word ischemia you have already studied, which is the lack of blood supply and the resultant changes in the organ, is called infarction, and it is a common health problem. So heart, it is very common, which lead on to high morbidity and mortality. And etiology, common etiology is atherosclerosis, as we have studied. And the two major types of ischemic heart disease, short form is IHD, which are angina and MI. MI is myocardial infarction. So the risk factors include hypertension, hypercholesterolemia, diabetes mellitus, smoking, lifestyle, diet, and genetic factors. Ischemic heart disease, when the myocardial oxygen demand is more than the supply of oxygen, ischemic heart disease results. And this is due to coronary artery disease, and the commonest cause of death in developed countries, that is 80% cause of death, and 1/3 of all the deaths in US and Western Europe is due to ischemic heart disease or IHD. So this is the angiogram of the patient with the myocardial infarction because of the stenosis of the coronaries. You can see the narrowing of the vessel, maybe because of the thrombus formation. And angina pectoris results in intermittent type of chest pain caused by transient reversible myocardial ischemia. So this is again causes chest pain as in myocardial infarction, but it is a reversible type of myocardial ischemia. And types of angina pectoris: typical or stable, princemetal or variant angina, and unstable angina pectoris. So pathogenesis, I described it earlier. Normal vessel with atheromatous plaque, platelet aggregation on that, leading on to the occlusion and thrombus formation, completely occluding the vessel. And myocardial infarction is death of the heart tissue due to lack of blood supply. That is the meaning. Myocardial infarction, death of the heart tissue due to lack of blood supply. And atherosclerosis is the common cause, and the resultant finding in the myocardium is coagulative necrosis. So along with our topic of necrosis, we have studied what is coagulative necrosis, and as a result of that, the cellular material is all burnt out, but the outline is maintained. Cell outline is maintained, and it is resulting from severe chest pain, breathlessness, sweating. There will be associated nausea, vomiting, radiation of the pain, etc. And the complications include a cardiogenic shock, death, or cardiac failure. Pathogenesis, the necrosis of the cardiac tissue. It is a coagulative type of necrosis, occur within 20 to 30 minutes after thrombosis. The infarct reaches its maximum size in 3 to 6 hours. And if you start the thrombolytic therapy, that is the therapy to lyse the clot, thrombolytic therapy, within this time. So once the chest pain is started, if the patient is getting thrombolytic therapy within 3 to 6 hours, the time in this time can reduce the size of the infarct. And site of the infarct, usually the left ventricle is affected. Isolated infarction of the right ventricle or isolated infarction of the atria are very rare. So the common site is left ventricle. Gross appearance. If you happen to examine the heart tissue grossly, in less than 12 hours, usually no gross difference will be appreciated. So if you examine the heart within 12 hours of the infarction, there will not be any change which can be appreciated with our naked eye. And if the infarct is more than 3 hours old, we can visualize the changes by exposing the heart slices to vital stains like triphenyl tetrasodium chloride. This, if the heart slices are stained with such a stain, the infarcted area is revealed as an unstained pale zone. Infarcted area will be seen as unstained pale zone. So this is the area which can be appreciated only with a special type of stain. And by 12 to 24 hours after myocardial infarction, infarct is grossly identified. So after 3 hours, these changes can be appreciated with the help of a special type of stain only. Up to 12 hours, there will not be much changes grossly. By 12 to 24 hours, gross by gross examination itself, we can identify a reddish blue discoloration caused by stagnant trapped blood. So this will be the appearance by 12 to 24 hours, that is by one day. Stagnant trapped blood, so there will be a discoloration like this in the gross examination of the cardiac tissue. And progressively the infarct become more sharply delineated as yellow tan softened area. So such yellow tan area will be appreciated. And succeeding weeks, the myocardial infarction evolves to a fibrous scar. Then microscopically also there will be findings. If you examine the cardiac muscle or the cardiac tissue which is involved by myocardial infarction, there will be a waviness of the fibers initially at the edges of an infarct. So this is the normal myocardium, and this is the early change called the waviness of the fibers. So that is the initial change. Then there will be coagulative type of necrosis within 4 to 12 hours of infarction. It will be followed by an acute inflammation which is prominent 1 to 3 days after myocardial infarction. Then there will be uh, the role of macrophages which will remove the necrotic myocytes and the neutrophil fragments, and the days are important, 5 to 10 days after myocardial infarction. So initially there will be waviness of the fibers. Coagulative necrosis starts 4 to 12 hours of infarction. Then there will be an acute inflammatory phase 1 to 3 days after MI. Then by 5 to 10 days after MI, macrophages take the role of the neutrophils, and their role is phagocytosis. They will remove the necrotic myocytes and the neutrophil fragments. The infarcted zone is replaced by granulation tissue, which is the tissue of healing, by 2 to 3 weeks after MI, and a dense collagenous scar is formed by the end of 6th week. So this is the normal myocardium, and this is the early phase called the waviness of the fibers. Then early changes where there is coagulative type of necrosis, neutrophil infiltration, large number of neutrophils will be seen. This is the almost like an inflammatory phase, and this is the histiocyte or macrophage infiltration, starts by 5 days, and their role is these larger cells are the macrophages, and they are the phagocytic cells. And later on in the healing phase, there will be granulation tissue formation with the numerous blood vessels, fibrosis, etc. And this is the healing of the infarct with a scar. So fibrous tissue will replace that area, and it will form into a healed infarct. And coming to the complications, myocardial infarction can result in cardiogenic shock and death of the individual. Then it can cause arrhythmias, cardiac rhythm abnormalities, conduction defects, then congestive cardiac failure, then mural thrombosis or embolization, myocardial wall rupture, then collection of the blood in the pericardium causing cardiac tamponade, ventricular aneurysm. These are the complications. And the laboratory diagnosis include elevation of certain enzymes, LDH, lactate dehydrogenase, creatinine kinase, troponins, Okay, last is aneurysm. It is the localized abnormal dilatation of the blood vessel um, or the heart. So it is involving all the three layers of the arterial wall or the wall of the heart, and then it is known as a true aneurysm. Example: atherosclerotic aneurysm, syphilitic aneurysm, congenital aneurysms, ventricular aneurysms that follow transmural myocardial infarction. All these are true aneurysms, and sometimes it can be a false aneurysm or pseudo aneurysm, breach in vascular wall leading to an extravascular hematoma that freely communicate with the intravascular space. Then it is known as pulsating hematoma. Example: ventricular ruptures after myocardial infarction. Classification: it is classified by the macroscopic shape and size into saccular and fusiform type of aneurysms. So this is the normal blood vessel, this is the true aneurysm, and it is in the shape of a saccular aneurysm also. All the three layers are involved, and this is the shape of fusiform aneurysm, and this is false aneurysm with the escape of the blood from the intravascular to the extravascular space. And this is the extravasation of blood because of the tear in the intima, and the blood will pass through the wall of the vessel. And causes of aneurysm, two important ones are atherosclerosis and cystic medial degeneration of the arterial media. Then trauma, congenital defects like berry aneurysm, which is occurring in the brain. Then infections, which are the mycotic aneurysms. Then syphilis or vasculitis. These are the pictures of the aneurysm. This much is the normal vessel, and this is the huge dilatation of the vessel, and this is the ruptured aneurysm. An arterial dissection is the case where the blood enters the wall of the artery as a hematoma, dissecting between its layers, and the dissections are often but not always aneurysmal. And the clinical cause: rupture and fatal hemorrhage, obstruction of the branch vessel tissue become ischemic, embolism from atheroma or mural thrombus, impingement on an adjacent structure, example compression of the ureter or erosion of the vertebrae because of the aneurysm, then present as an abdominal mass which is palpably pulsating, which simulates a tumor.